did CBT come into existence? What was that eureka moment when you discovered CBT?
So CBT was not discovered like a hidden treasure. I had started my professional life as a psychoanalyst, and I had got credentialed by the Philadelphia Psychoanalytic Association. So I wanted to prove that psychoanalysis actually had a sound empirical basis. So I started looking at the dreams of depressed patients, and according to the psychodynamic formulation, people who were depressed should have dreams in which there was a lot of hostility. The whole notion being that the self-criticalness and the suicide ideation and the hopelessness that depressed people have is due to the accumulation of hostility, but the hostility is often towards somebody who is cherished and treasured, and so on. And so it's turned against itself. So we did a dream study, and we compared the dreams of depressed patients with the dreams of non-depressed patients. And it turned out that the dreams of depressed patients showed less hostility than the dreams of non-depressed patients. So then I figured, well, maybe the theory is wrong, which was unprecedented, that any investigator would find that his theory was wrong. And I started working this out with my patients, and I discovered that the dreams of the dreams of depressed patients, which showed a lot of frustration in the dream, disappointment, frustration, and so on, and it all often showed the individual, the patient, as ungainly, as weak and helpless, and so on. I decided that perhaps this is the way the people saw themselves. And so I would ask the patients, how do you see yourself? And they say, I see myself as weak, helpless, and so on. And I thought, okay, this sounds rather simplistic. What the dreams do in very graphic form is that they portray the individual as he perceives himself. And that was the first step. But it wasn't quite an aha experience. The next step, I decided to sit the patients up, get them off the couch, so that I could explore this better. And I would ask them, is this the way you see yourself? And they would say, yeah, this is the way I see myself. And then I would say, what is the evidence, or are there alternative explanations for why you see yourself this way? And that was the birth of cognitive therapy, because at that point, the patient's view of themselves would change once they started looking at the evidence, and they saw that the evidence was overwhelming, usually, on the other side of the fence. And when we would deal with discrete incidents of their misinterpreting situations as reflecting on their own worth, their own ability, on their own importance. When I intervened in that particular way, the people started to get better. And so that was the first step in the birth of cognitive therapy. But what I did call it at that time, I changed the name from psychodynamic therapy to ego therapy, and then eventually it became cognitive therapy. That's the short version.
I think that was excellent.